Cool. So what we're going to look at this evening is a little bit of discussion about what we're looking at when we look to create a St. George's physiotherapist. I'm going to chat a little bit about the course structure and how the course is set out over the 3 years for the BSc program, the main themes and the curriculum that we're going to study as you studies to become a physiotherapist, a little bit about how we get there, assessments and how you will be examined and tested, because that's always something that comes up very early on in learning. So just talk about that now, and a little bit about why to choose St. George's University too. But I think before we even get there, it's really important to consider if physiotherapy is the right career for you, if you want to become, why you want to become a physiotherapist, and what physiotherapy actually is, and what we do as physiotherapists. So something that a lot of physios do and is central to our practice and our experience is seeing movement as central point to health. So being able to be mobile, active, physically active, moving in different ways and sort of in accessible ways is really important for us to promote our general health. Physiotherapists also work to treat different problems, either caused by injury, illness, and we treat with different techniques like hands-on therapy, which is also called manual therapy, exercise, lifestyle, and a big public health promotion side too. We help people to get better, to get back to doing the things that they want to do, and we try and help to speed up that process as much as we can. We're very skilled in the way that we communicate with people. A lot about what we do with our patients and the individuals we work with is about the communication side and being able to understand someone, almost understanding a bit of a psychological side from their illness or their disability or their injury that they have, and how we can work together with them. We work autonomously, means that we can work independently. We have our own body in terms of the CSP that we work for, the Chartered Society of Physiotherapists. We don't necessarily have to have referrals that come from other healthcare practitioners, so we can be getting people to come in sort of from the self-referral protocol. And we also do work really well as part of the multidisciplinary team, and we recognize the scope of practice that a lot of our colleagues and allied health professions and medicine have, and how we can work together. As mentioned, we really consider the psychological side to care, but we also consider the cultural and the social factors affecting the health of people. And we assist people to play a big role in helping themselves. So a lot of physiotherapy treatments is now very active. We empower people to get themselves better and to help themselves, rather than it being us doing something to someone. We really look to engage people in their own healthcare. And really importantly is that we work in multiple specialities, which we'll talk about in a little bit. So as I mentioned, a lot of physiotherapists are under the Chartered Society of Physiotherapy, and we are all registered with the Healthcare and Professions Council. We are working in multiple different sites or specialities, as I mentioned. So we're utilizing our knowledge and skills sorry, it's going ahead of me there, utilizing our knowledge and skills to improve a range of conditions that are associated with different systems of the body, such as neurological conditions, so stroke, multiple sclerosis, Parkinson's disease, neuromuscular conditions such as back pain, whiplash, sports injuries, our cardiovascular system, so chronic heart disease, and then also our respiratory system, so patients with asthma, obstructive pulmonary disease, and cystic fibrosis. So we're really working in a range of different specialities, so a range of many health roles within healthcare and social care. We also work in education and research, as well as service management, so we can move out of our clinical roles into a more management point of view. And so on this slide, you can just see the many different specialities or areas that physiotherapists might work in. Apologies for it moving ahead. It seems to be on a timer, which I can't stop while I'm busy doing the presentation, so I will be flipping back a couple of times. What I wanted to explore here is just to show that physiotherapy is so much more than we might see on mainstream media, on social media, where it seems to be a lot of sport and musculoskeletal disorders. We really have this huge scope of practice that we can work within. And during our course at St. George's University, we are there to make sure that you're able to then go and work in those different areas. We provide you with the experience and the opportunities and the learning to work across the physiotherapy disciplines, and to try and find where your niche or your interest is, so that you'll be confident and skilled enough to go out and practice in that when you qualify. So when we're then looking at what we can do to create a St. George's physiotherapist and what that means, we go through a couple of different processes. So we look at a values-based recruitment system. So we're not just looking purely at your academic results. We want to consider you as a person, as an applicant, and as a student. We combine that with interdisciplinary learning. So I've mentioned about the multidisciplinary team and working with other allied health professionals like occupational therapists, radiographers, paramedics, also other medical specialties in nursing and medicine, and how we all work together to create the best care for our patients. So we start that early at St. George's, where you're starting to have interdisciplinary learning. You'll have certain learning modules or subjects that are done with students from different courses. So we can start to understand everyone's profession and how we can work best when we do qualify. We also then bring in learning development and teach you skills and engage you in ways to promote lifelong learning, which is really important in healthcare. As healthcare landscape is continually changing, we need to be able to continue to adapt and change with that. Big example currently is with the development of AI and how that might change learning and healthcare, and how we've got to be able to adapt to that. So we put all these factors together, and that leads to you developing the values, knowledge, and skills to be autonomous, independent, problem-solving practitioners, with the confidence and capacity for great teamwork and excellent patient care. So that's where we lead to this transformative education. At St. George's, we also have a really high employability rate. So 100% of our students post-graduation will go on to find jobs. And that's if they decide to stay within the physiotherapy career. And that might be in private practice, it might be within the NHS, it might also be going down that education or research route. So we can almost guaranteed a job in a way once you're studying to be a physiotherapist. There's a great need for physiotherapists. We also help to develop confident practitioners who work well with colleagues, offer excellent, compassionate, person-centered care, and adapt rapidly to the changing healthcare environments. So I'm going to talk now a little bit about our BSc physiotherapy program and what it will look like over your couple of years, your 3 years that you'd be studying BSc physiotherapy. So we achieve the transformative education and developing great professionals and clinicians and leaders through the development of professional knowledge. So that's things like our clinical and basic skills, anatomy, physiology, and pathology. We consider the changes that occur to the body as a result of various disease, injury, changes in development or abnormal development. And we look at various factors that start affecting people's outcomes, whether that is something physical or biological, or whether it is something social, psychological, or related to public health. We also consider the professional skills, so things that really make us great professionals, communicators, and leaders. So our clinical skills, how we handle and work with patients, the communication skills and how we listen, how we talk, how we allay and array education and information to people, and also developing skills like reflection and clinical reasoning so that we can consistently get ourselves to be better. So we see how something went and look at the positives and the areas for development from that, the taking on that feedback and how we develop from there. So currently, in the way that our course is structured, in your first year, you have 4 main modules. So we have 2 interprofessional modules. That's essentials of allied health professionals and factors influencing professional practice. So those modules are done with students from occupational therapy, diagnostic radiography, and paramedics. And they look at some of our professional skills that are required, while also developing the professional knowledge. And alongside that, we have some physiotherapy specific courses. So the principles of physiotherapy assessment, which incorporates some anatomy and how we then go about assessing patients across a wide scope of specialities. And then towards the end of the year, you then start to work on how you develop the treatments and the rehabilitation, considering some more specific pathologies. These all create a really great foundation for our second year, where we start to work a little bit more on our specialist subjects. So cardiorespiratory physiotherapy, neurological physiotherapy, and musculoskeletal physiotherapy. So what these modules will be focused more along those specialities, how we then develop what we've learned in our first year and continue to progress that. We also then have the opportunity to start working on a research project. So towards the end of your second year, you'll work in a group to start a proposal for a research project, which you'll then complete in your third year. And towards the end of your second year, you also start your clinical placements. We'll talk a little bit about clinical placements in a bit. And then in year three, we really start to bring in that higher level of education and thinking, and how we can start to really develop what you've been taught over the previous 2 years, and using that experience from clinical practice to start thinking at a much higher level and getting ready for graduation and going out into the clinical workforce. So through that, we have some professional courses like professional development. We have our quality improvements, which is another interprofessional module. Complex management, where you're reviewing much more complex cases where there's multiple factors that might be involved in a person's recovery or illness or injury. And then you also have the opportunity to finish your research project. Again, in your same groups, you'll be developing what you did in your second year and actually running the project and reviewing that. So it's a busy course within 3 years, but everything is scaffolded and there to support you from year 1 to year 2 and year 3, so that by the time you graduate at the end of year 3, you feel ready to go out into that clinical workforce. You have that experience, you have that knowledge and the skills to be able to go work independently. To be able to get there, we use a wide variety of different ways to come about teaching. So technology is obviously a huge part of how we teach. We use a virtual learning environment called Canvas, where we upload all of our lectures, our practical and tutorial resources, as well as additional learning resources, links to specialist services, links to videos on YouTube, and so on and so forth. We record all of our lectures, so anything that is done as a live lecture will then be recorded for you to review at your own pace, because we completely understand that sitting in an hour-long lecture is not always the best learning environment for some students. They need to process things a little bit differently, so you have that opportunity where you can go watch it back at your own pace. We use online resources like Mentimeter and Kahoots to do live polling. It's technology which really gets some good engagement. It's really nice when we're doing sort of quizzes to try and strengthen your learning. So not necessarily quizzes for marks, but more quizzes for learning. And you can have a lot more engagement from a class doing that when they're kind of competing against each other in a way. We have a really well-resourced library and an extremely supportive library team who help our students with finding the books and resources they need, but also helping them with writing skills and developing, which is really important in the physiotherapy course. And we have access to online courses outside of the university through Physiopedia Plus, which has a huge range of online courses done by specialist clinicians around the world. So that can really support your learning on top of what we're doing and teaching you already. Our teaching is done through a few different means. So our approaches are we do lectures where we will bring in the theory around a concept or a topic. And then that is strengthened and we sort of gain greater understanding through then doing different tutorials around that. We also link to sort of other directed learning. So we're able to put links of other talks and other reading to be able to support what we've done in the lecture space. Our tutorials are also really good for practice-based and problem-based learning. So where we will take different case studies based on the theory that you've been taught and how we start to apply that more to patients and case studies. We're very hands-on at St. George's University in the way that we approach our teaching. So practical classes are a huge part of what we do. So we have timetable practical sessions throughout your first and second year, where we're really working on developing those hands-on skills, how we develop our communication and movement with patients, how we get comfortable with working with the human body. We also, as I mentioned, we have taught anatomy in the anatomy lab, where you're able to see the intricacies of the human body and how things are working at a much deeper level, which then links really well into what we teach you from a practical point of view. We have good access to clinical teaching from expert clinicians, as well as patients and service users coming in and teaching and providing their experiences, which is a really great way for us to learn how to bring in best practice. And then one of the greatest learning tools that we have is practice-based learning. So those are the clinical placements that you would go on in your second and your third year. So here's just a little snapshot of one of our lab spaces. So we have 4 lab rooms, which are all kind of mirrored on this. They have big screens on either side, lots of plinths, lots of space, and we have sort of fully stocked with lots of equipment. In this specific lab, we have a simulation area. So the picture on the bottom right and the bottom left, you'll see there's some mannequins and some hospital beds. This allows us to simulate a more hospital inpatient type of environment where we can put on lots of different attachments to the patients. We can make the space a little bit smaller so that when you go out to placement to a hospital, you feel a lot more comfortable working around that environment than if you hadn't had the opportunity to work with that. Those mannequins are also really important as part of our cardiorespiratory teaching in terms of how we can work on respiratory techniques, suctioning patients, listening to their breath sounds, because they all have hardware that allows us to listen and assess them much more in depth, which really helps to develop those skills, which you wouldn't necessarily get unless you're working with patients. So talking about our placements, over our 3 years, we do 5 clinical placements. So they normally start in your second year and carry on into your third year. Each placement is 6 weeks and averages around 30 hours per week, with your hours reflected by the pattern that the placement has. So what I mean by that is some placements you might do 3 long days or 4 long days and have a day off in the week. Others might be your typical 9 to 5 or 8 to 4 working pattern. And so it helps to train you up and get you with that, having that experience to work clinically and to go out into the workforce. We have a dedicated placements team who arranges these placements for you. And all of our sort of placement locations tend to be located within the M25 corridor. We wouldn't expect you to travel more than an hour and a half or a typical London commute away from your home address to get to placements. And that doesn't mean that every placement you'll have will be an hour and a half away. We try and accommodate for that. So if you've had a little bit more of a commute to a placement, then we try and give you some other placements that are a little bit more local. But to be able to give you the wide breadth and experience at different placements, we sometimes do need to look a bit further afield. Even though we're based in a very specialist hospital, we want to try and give our students a really broad experience of the placements that they have. There is potential opportunity for you to arrange a placement abroad or internationally for your final placement. And our placements are across a variety of different sites, settings, areas of practice, which are really reflective of contemporary physiotherapy. In total, it leads to about 1,000 hours of clinical practice, which is flexible for those students who are international students and maybe registering from abroad. So when we are having our assessments, we assess our students in a wide variety of different ways. Again, understanding how people respond to different types of assessments and different types of learning. We want to create a fair and open field in terms of our assessments. So throughout the different modules, there will be different forms that we look at, whether that is a written or multiple choice exam. We have different coursework, which might be written assignments that you would need to complete, or presentations that you might need to do in order to complete the module. A lot of our specialist practices have, or modules have, practical exams where you'll have a simulated practical or clinical environment, and you'll be observed by an examiner. We have different presentations, and for your placements, we have a reflective portfolio. And then one of the big pieces in your final year is to do your written research project. As I mentioned, that's a group project where you are trying to understand an area of physiotherapy in a little bit more detail. And you might have done a survey, you might have actually had participants come in and you've done some specific testing to try and understand a certain area of practice a bit better. Every research project has a research supervisor from the academic team. A lot of us have a lot of experience with research, so we're there to support you throughout. And it's a really nice way to get to grips with the understandings of the research around physiotherapy, how to understand that and interpret that and use that to your best clinical experience and clinical skills. So our selection process at St. George's, as mentioned at the start, we're not just purely based on your academics. We look at sort of other non-academic components too. But our academic component that we're looking at for physiotherapy is at an A level. We are looking for an ABB. This is for the BSc program, having 5 GCSEs graded 4 and above. If you've done a previous undergraduate degree, we would be looking for a 2-2 and a degree in a related subject. So that might have been sports therapy, rehab therapy, sports rehab, something along those lines, anthropology, human kinetics, or a 2-1 in an unrelated subject. So we're thinking maths, history, philosophy, finance, things like that. We also look at international back scores, access diplomas, and BTEC diplomas at a triple distinction. Our non-academic criteria is that you demonstrate an evidence of a commitment to physiotherapy, a good understanding of what physiotherapists do, relevant work experience where possible. And we understand work experience is one of the most tricky things to get at the moment. So if you can demonstrate that you've attempted to do that, or you have managed to go through work experience, and that is something that really supports your application. We look at a demonstration of the key values of NHS and healthcare and physiotherapy, and that comes through your personal statement, which you would be doing, and then as well as police and health checks. So your occupational health and your DBS checks will be completed by the university before you can complete your registration. Once we can see that you're on track, so either you have the predicted grades to meet the academic criteria, there's no concerns around the non-academic criteria. We also have a interview process, which we do. So we do what's called a multiple mini interview. And if you're based in the UK, then we do that in person. If you're an international student, then we'll do them online or remote version. But what this is 6 different stations that you do with 5 different examiners to try and reduce bias, but also allow different people to get different aspects of you. At each station, you'll be provided with a different type of scenario or case or question to answer. So it's not 1 hour long process that you've got to sit and talk through. It's about half an hour, so 4-minute stations that you'll be working through, and each station has a slightly different scenario, looking at the different aspects of healthcare, of NHS practice, and then the specifics around physiotherapy. It's not a knowledge test. It's about understanding you as a person and how you would respond in different situations, and your reflection and understanding of interpretation of different sort of scenarios and events. So it's a really nice way. We get a lot of good feedback for the MMIs, and it's a really nice way for the team to start to get to know our applicants and potential students going forward. So the last little bit is to why to choose St. George's above any of the other universities that you might consider applying to, and why to come to physiotherapy possibly rather than any other degree. And hopefully I've explained a bit about what physiotherapists do, and that's really caught your eye and really interested you or aligned with where you are wanting to go. But our program has a really diverse community of students and staff. So we have lots of students that are local to the UK, but also from internationally and from abroad, as well as our educators and our lecturers are also from the UK and abroad, bringing in lots of different diverse experience, understanding of different cultures, which really helps to support and develop our learning. Each student has a committed personal tutor, so each student will have a personal tutor who will follow them and support them through their 3 years of study, either personally or through academic support. So you always feel that you are supported, and we have a great community around that. We have the physiotherapy labs, which are fully equipped, as mentioned, but there's also after hours access. So students can come to use the physiotherapy labs after hours up till about 10 o'clock in the evening to refine and define their skills even further, to practice pre-exams, and just to really build on the foundation that we're providing them. We teach with experienced clinicians and academics who have a wide variety of experience across different specialities. As mentioned, we have our specialist placement support so that you don't have to try and source your own placements. The interprofessional learning across your first and final years is really important for helping to develop the multidisciplinary team and wider workforce for when you go out into clinical practice. And we also have a great academic success center and library support who can help you and develop your more academic skills in terms of writing, speaking, and so on and so forth, who work really closely with our team to be able to help develop our students. I'm going to stop sharing there. So I'm going to mute myself. I don't know if you're able to turn your camera on. There we go.
Yeah,
Great.
yeah.
And you can just do your spiel. So thank you very much for joining us tonight.
No worries, it's a pleasure. So my name is Nazat, well, Jahan Iqbal, but you can call me Nazat. I'm studying physiotherapy here at City St. George's, and I'm a first year, and I'm studying the BSc course. And the reason why I chose physiotherapy is because of the holistic approach that I can take, that not only would I be able to treat the patient by looking at them and physically going through their journey, but also being able to see other aspects and how that affects their progress. And I've always been interested in anatomy, and in physiotherapy, you go very deep into the human anatomy, the physiology, and the bio processes like that are present. And I felt that was a really good it was very fit for me to actually pursue a degree in physiotherapy. And what I really like about my course is that it's very diverse, and I've met a lot of students from everywhere, and I've been able to speak to them, talk to them about their cultures and learn more about them. But also, what I really like is that it's well structured. So we also have the support that we need while also being independent. So, for example, on Fridays, we have self anatomy lessons. So we just learn it ourselves and then we go over it on Tuesdays. And I feel that that's very structured, and it actually helps me to understand the subject itself. And that comes along to what my schedule is like. So on Mondays is mostly designated to like lectures on the main physiotherapy course, and after that we have practicals that are related to that lecture. So so you that where the, so there you can practice on each other after the lecturer lets you know what to do. So they would demonstrate on a student, which would be the model, and we get to practice this with my peers. And I feel like that's very good because I'm able to actually do the hands-on and learn it myself without having like reading a textbook or just going through a lecture. So I feel like that's very well put. And coming on to how I balance my study and like my social life. A lot of people may think that is actually hard, that university is very like it's there's a lot of stuff to do, and it is true. There's a lot of work that you have to put in, but what I felt that it's very useful for me is that I do the work that's due, or like the lectures that I've gone through, I finish them in the evening. So I review them and see if I have any gaps in my knowledge, and that way I can ask someone or Google it more. And that way I have my weekends free, so I'm able to commit to my family or my friends, or even just some time for myself. And coming on to I'm situated in the Tooting campus, but I do not live at halls, so I do not live on accommodations provided by St. George's. I commute from around central London, so it's about an hour. So I decided to commute, but I've seen the accommodations and they're very nice. So if you are interested in that, I do recommend it. And also the area here in Tooting is actually very nice. It's very diverse, as I mentioned before. You can find anything and everything. And it took me a while to actually get a job and see what's around. So like, and I'm seeing new things every day. So when I come out the station, and there's really good like restaurants and cheap places for students to go. And I feel like that's a good thing about Tooting, and the food is really good. And there's also a lot of societies at St. George's, City St. George's, that most of them are sports, but there are also other societies like music and like first aid, and these are also accessible to everyone. So you just have to sign up during Freshers Week, and they're all very nice. And I'm part of the badminton society, and so far it's been very good, and everyone's been welcoming and accepting. So yeah, that's all for me. I hope it's been useful.
Great, thank you so much for that. I think what we're going to do is open it up to any questions. I think you should be able to put those in the chat, and then we can answer that either directed at me from an academic point of view, or if you've got any further questions for Nazat. I suppose I wonder, Nazat, if before we sort of run away, and that is, how did you find the application process? Because I think that's probably a lot about what people want to know about at this stage too, is how did you find the applying to uni, going through the MMIs without giving away any questions or answers? Yeah, how did you find that process?
I found it, prior to it, I was kind of stressed. But if you actually have the interest in the subject, you would see that when you hear the questions, it's like you don't have to think much about it. You just have to say what you think is the best, like what you yourself would say, instead of what you would think they want to hear. Just be yourself. And I feel like that's very important. And obviously do a little bit of research around like physiotherapy if you didn't know much about it, what are the different types and stuff. So yeah.
Great, thank you. I see we've got a question from Zahara. So we do contextual sort of admission. So what we mean by that is there are lots of students who might have, as you might be going through, Zahara, is to do a couple of A levels or B techs and a few different courses. So we do consider those. So it doesn't have to be that you've done everything through an A level or everything from a B tech point of view. We do look at a combination of different ones. So in terms of the BTEC subjects, what the best thing to do is to have a look at the St. George's website. I'm just trying to bring that up quickly, which has got all the different entry criteria for the different courses. We don't specifically look at, like from an A levels point of view, where we're not expecting you to have done biology and chemistry and things like that. They may be desirable, but they're not essential courses. But let me just bring it up and I'll put it into the chat, the website, so that you can have a look at that. So Lucy, I'll go Jane. Yeah, so Jane, I'm also one of because of my admissions role, I'm also part of the admissions tutor for the MSc course. So it's done through our same admissions team, but you can contact me and I'll put my email address in the chat. So first up is the physiotherapy link, and then my email is rthorpe@sgul.ac.uk. Where are we? So Lucy, the interviews start in January, and then they run through till about April, May time. So they normally run a couple of sessions a month, and they once you've done the application process and you've been invited to an interview, they'll give you different options of when you might be able to attend. So Eloise, that's maybe a difficult one to answer. If we met our number of students that we're looking for and they all had A star, A star, A star, then the course might fill up, but it is sort of more probably on a first come, first served basis. So if you meet that entry criteria, um, you're eligible for the course. So it depends on when you came through with that, if that makes sense. So it doesn't preference you necessarily in that way. Emma, so it's a mix in terms of lecturers being clinicians still or not. So it's probably a fairly even split at the moment, where quite a few lecturers are still practicing or have recently stopped practicing. So myself, I'm a musculoskeletal clinician, and I haven't practiced for about a year, but it's something that will be getting back into in the near future. So some people might take a little bit of a break from the clinical practice, come back into it, or others are more focused on the research side. Um, all right. Any other questions? Thank you for those. I think they covered some really good points too. So yeah, we would consider those subjects too. Because normally a lot with the sports and exercise science, you're covering different sort of science and healthcare aspects in that too, which would be relevant for the course. Jane, yes, we do have mature students on the course. Interestingly, it seems that there are more mature students on the BSc course and on the MSc, and I think one of the reasons for that is maybe the time out of studying. So if someone has done a previous undergrad or previous degree, then they want to change their career path, they're more likely to go through the BSc to get back into that routine of studying. But we do have a mix of students who have come straight out of school and a mix of students who are in their 30s, sometimes 40s, and older, looking to change their career. And I think it creates a really great learning environment because it's more than just about the clinical learning. It's a lot about life learning and working with different people in your learning groups and your class groups. So I think it makes a great environment. Lucy, yes, there's a student library. So the library, as far as I understand, is open 24 hours, but you can also access everything offline. So a lot of our students will spend time in the library, which is based in the university. Yes, all of our lectures at this stage are at the Tooting campus. I'm sure some of you might have seen that we have merged with City University to form City St. George's, but everything from a physiotherapy point of view at this stage is still at our Tooting campus. Sorry, I've just so Eloise, so in term, as long as you are meeting the entry criteria, you can be invited for an interview. So that's the entry criteria that I mentioned in the talk. There's nothing else that they would necessarily be looking at that stage. And then if you were successful with your entry criteria and your interview, that's when they look at doing the police checks and occupational health checks. So it is contextual until everything comes through, or sort of an conditional offer until everything comes through. But as long as you're meeting the grades and there's other aspects from applying through UCAS, then you'll be invited to interview. So Jane, so the question, can you organize your own placement? So for the final placement where you have the potential to arrange something internationally, there might be some scope for you to arrange your own 1-2, and that's something that's discussed then with the placements team. It can sometimes be difficult um, to arrange that, just because making sure that the different placements all have the correct insurance and are able to support students appropriately. But it is something to look at. The MSc and BSc programs are run by the same placements team, so it'd be the same discussion. You also have the same length of time with your placements. The MSc, our master's program, also has 5 clinical placements of 6 weeks. Right. All right, so there, we'll maybe give it another couple of minutes just for any other questions. So what are the IELTS criteria? Sorry, I have just bringing that up. I think that is correct, Shunyun, that it would be a 7. I'm just bringing that up because that's normally checked by the admissions team before it even comes through to us as the physiotherapy team. So I'm just trying to see if I can find that online for you quickly. Again, it's on the same link that I had put. Um, um, so what I would advise you to do is just have a look at um, the entry criteria, and then if you go to the English language criteria, it specifies exactly what you need in the different levels. Um, okay. So the application deadline, Zahara, is the 29th of January. So that's when our entries are going to close. So 29th of January 2025. With the start date in August, September in 2025. So Lucy, yes, that is the same for the MSc program. Just putting that up quickly. Yeah, so for both courses, that's the same. Be 29th of January 2025. The master's program tends to start towards the end of August, and the BSc starts sort of mid to end of September. I think something that maybe wasn't discussed in the talk is normally around the class size or course size. So for our BSc program, we look at recruiting around 65 to 70 students, not more than that. And then you are, in your group, you're then split up into 3 practical groups of about 20. So it means that your practical classes are a lot smaller, which means that you're getting a lot more support. And then for your bigger lectures, you would be sort of the whole cohort. For those who are interested in the masters, that the masters cohort is about 40 students, and we split that into 2 groups. So in terms of different clinical placements, it's so for example, some students will go to placements in the St. George's Hospital, and they might be on placements in ITU, or they might be doing something that is more orthopedic or post-surgical in nature. There are students who will go out into the community and be doing community home visits. There are students who are going to musculoskeletal or outpatient clinics. So it's a really wide variety, and they can be, as I said, across London. So some are going to be local to Tooting and around. Some might be a bit further afield to other major hospitals or clinical placements. The In terms of will physiotherapy go into clearing, at this stage, it's not something that we can necessarily say, because if we fill all of our spaces pre-clearing, then we wouldn't go into clearing. It is something that we have gone into in the previous years, but it's hard to say at this stage in terms of whether it will be in clearing towards the end of the year. And so Jane, some of the MSc and BSc students do go to the same placements and will be on placement together, but it depends what year they're in and sort of what module they're doing for their placements in terms of how they're graded and assessed and the type of expectations that they might have. So there will be some placements where you might be the only student on their placements, and then there's others where you might have a group of students or maybe some students from another university who are around. And I think we'll give it till 5 too, if there's any other questions. So Lucy, it's we do a research project which our students do a little bit differently in terms of the way that they write it up. They write it up as if they were going to be submitting their findings to a journal or a publication. So it's slightly different to a dissertation, maybe a slightly smaller word count, but they still would be doing a research project. So either doing interviews, doing surveys, or actually doing some physical testing with patients or participants. And then they'll write that up. There'll be statistical analysis involved in that. They'll need to write up a discussion. They'll need to write up their findings and how that links to practice, or how things could be done a bit further or developed. Yes, so that would be for the MSc and the BSc. In the BSc currently, you do it all as a group, so normally groups of 4 or 5. Whereas the MSc, they might do the data collection or the project together in a small group, normally about 3 students, but then you each write up your own individual project based on that. So for the BSc, Martin, we normally look at about 65 students. We offer about 65 places. I think that in Nazat's year currently there's 64 students, so it's quite a full cohort. So that is, maybe let's ask Nazat that one. So Nazat, how many hours studying do you tend to do on top of the lectures?
Yes, on top of the lectures, I actually this is it depends on you technically, but for me, I just review the lecture and then I go over and make some notes and try make some flashcards. And that varies for different people, but generally I would say maybe 2 hours. And then if I want to go into detail, then maybe longer. But I section it out. So it depends on you. But yeah.
Yeah, I think that there's quite a big variability in that, Jane. I think that we provide a lot of resources for there to be additional learning on top. But yeah, as Nadat was saying, a lot of students will go back over the lecture and make sort of further notes on that, and then you can research those topics a bit further. There are quite a few students who do part-time work too, so they are balancing their studies and part-time work. The difference between the BSc and the MSc is that the BSc is normally more on site and learning 3 times a week. Whereas the MSc, because it's a 2-year course and it's more condensed that we're trying to work through, at the moment they're on site normally Monday, Tuesday, Thursday, Friday, sort of full days. Wednesdays generally a lot more flexible because of university sport that happens on those days. But that will vary between the different cohorts and the different students. Right. Great. So I think we can look to wrap up there. My email is was on the presentation and is obviously in the chat. So it's rthorpe@sgul.ac.uk. Have a look at the link with the entry criteria for the course too. A lot of the questions are answered there, and also if there's anything more from a admission specific, maybe less course specific questions, those can be addressed to um, the admissions team. So that's admissions at SGUL. And yeah, if I obviously get a huge influx of emails coming through to me, then I might also just ask my colleague Sanchez, who is one of the other admissions tutors, to just help and support me with that. If you didn't make it to the open day that we had a couple of months ago or a month or so ago, then look out for any other on-site open days and things like that if you're wanting to have a bit of an explore around the campus. Otherwise, we possibly see a lot of you in the interviews in the coming months. So Martin, I'll probably answer that one. Interviews are going to be starting in January. So the admissions team will probably be starting to offer different times in that fairly soon. Okay, brilliant. Well, thank you so much, and thank you for all the great questions. I really hope that was helpful. Sorry about all the nose breathing or catching whatever sinus problem has been going around with everyone. But have a wonderful evening, all, and thank you again for spending a bit of your time in the afternoon with me now. And thanks, Nazat, for your support.